Good afternoon. I am Tammie Epps, and I'm the manager of media relations and social media here at Prisma Health. And what an exciting day it is today. We have a great announcement with some of our great physicians that I'm going to let them tell you all about it. So I put their names in the chat. And so I'm going to stop with that. If you have questions, remember, we're going to put them in the chat at the end. We have our four speakers actually, and their names and titles are in the chat. So you don't have to have them say them and spell them. But I would like for them to start off talking a little bit about how they've been impacted or how they've worked in transplant before. So we'll start with that. And then if you need anything else, just let us know and we'll be here in the background. So with that, we will go with Dr. Merchant. So Dr. Merchant, you see his title there, and I'm just gonna let him talk a little bit about himself to start off. And he has our initial comments. So let me find him. There he is.
Hello.
There you go.
Thank you so much, Tammie. I appreciate it. I'm Todd Merchant, Program Director of the Prisma Health Kidney Transplant Program. We are just getting started and excited to be here today and humbled at the opportunity. My experience in transplant is almost 20 years. I started in transplant in 2002 in my fellowship at University of Cincinnati, where I completed a multi-organ transplant fellowship and continued through my career after that. In 2004, started out in Washington State and then progressively moved from that program to Medical College of Georgia, where I was the director of the transplant program for about 7 or 8 years, in Augusta for about 13 years, where I called on the nephrologist and the community up here to do outreach and take care of their patients a good bit. So I have a good understanding of the community down here. And we started here in May, getting the program ready to get up and running, and have been working hard and diligently to be ready for this day. And so we are super excited to get going and start transplanting as soon as we possibly can. It's a great resource for the community, and we're thrilled to get started.
All right, with that, we are going to go to Dr. Superdock.
Thank you, Tammie. I'm Keith Superdock. I'm the transplant nephrologist that is helping get this program up off the ground. I have nearly 30 years of experience in transplant. I did my nephrology fellowship, was briefly on the faculty, and then did a transplant nephrology fellowship at Vanderbilt back in 1992. In 1993, I had the opportunity to start a kidney transplant program from scratch with the help of my surgical colleagues and other team members in the Philadelphia suburbs. We managed that transplant program for over 20 some years, and my daughter moved to South Carolina, told me about Greenville Memorial Hospital opening a kidney transplant program, and recruited me to the Upstate to help start this program. It's been a real thrill to work alongside Dr. Merchant, and we've assembled a great team of professionals, social workers, dietitians, coordinators, et cetera, and we're looking forward to getting started.
Great, thank you. With that, we're going to go to Dr. Shusterman. There he is.
Hi, everybody. My name is Blake Shusterman. I am a nephrologist at Carolina Nephrology in Greenville. I've been practicing here in the Upstate for about 12 years. And I am so excited to have a transplant program coming to Prisma, to Greenville. I think this is going to be transformational for our patients, for everybody who lives in the area with kidney disease. We have a number of dialysis programs, and there are probably close to 2,000 or 2,500 people in the Upstate in this area who have ESRD and who are on dialysis. And a lot of the barriers over the past 12 years that I've noticed in getting people transplants has been the fact that we don't have a program in our vicinity. Everybody has to go somewhere else, to Charleston or to Georgia. And I am thrilled to be able to have this opportunity for our patients. I think it's going to allow many more people to get waitlisted, remove a lot of the barriers that they have towards getting transplants. And I'm super excited to get this moving forward.
Thank you so much. For that, we're going to go back to Dr. Merchant. So he's going to kind of talk about us getting started and all that. So Dr. Merchant.
Yeah, we're thrilled to be up and getting going. You know, it's a big process to go through, and totally appropriately. It's a complex series of events that has to take a patient from first receiving the diagnosis of kidney disease and kidney failure to a transplant. And so there are a lot of understandable hoops to jump through, and that's what we've been doing most recently. We submitted our applications to the United Network of Organ Sharing, the entity that oversees the transplant list and deceased donation in the United States, and have just received our approval. Prisma Health has been absolutely 100% supportive of this entire endeavor for the patients of South Carolina, and have given us just a massive amount of support from every single person within the hospital system, all the way through the administration. They have had one singular goal, and that's to provide the best possible care we can in a caring and comforting environment here, and deliver care in the most efficient way we possibly can to get a patient through their process in the most humane way we can. Getting them to that final point, which is a transplant, which we know is such an amazing life-altering event, not just for the patient, but for their entire family, because it cascades through everyone close to that patient when their health is taken to a different place, and such a better quality of life is provided them. So we're just thrilled to be taking these steps. This is a key one. Our next one will be to transplant our first patient, and we are looking forward to that hopefully in the next few months. Right now, we are just starting to see patients this week, hopefully, in our offices, and we are just raring to go.
Thank you, Dr. Merchant. With that, we're going to go to Dr. Superdock again, let him add some additional thoughts.
Yeah, I think I can piggyback upon what Dr. Shusterman and Dr. Merchant said. Dialysis is an amazing technology that can keep people alive for decades who have basically no kidney function. So dialysis is amazing, but there are major impacts it has on your lifestyle. The dietary restrictions, fluid restrictions, time commitments to either go to a center to have a dialysis treatment or to do dialysis within your own home. Many medications that have to be taken, very difficult to travel because you have to arrange a dialysis unit to accommodate you wherever you're traveling, or bring your travel supplies with you if you're doing it yourself. And so to have people who are struggling with the burdens of dialysis dependence be able to receive a surgery, receive that kidney, and then get off some of these medications to be freed up to travel, to feel better, and to be able to reclaim some of their life is just an exhilarating part of the healthcare team, or part of the healthcare system to be a part of. It never gets old, it never gets dull, it's always exciting. And again, to be able to do it here in Greenville is a great honor, and we're excited and ready to get going.
All right, with that, we're going to go back to Dr. Shusterman to talk about the fact that he's going to have a lot of patients that'll be able to stay close to home.
You know, as a nephrologist, there's no real better day for me than when somebody that I'm seeing in the office or in dialysis gets a kidney transplant, because of the way that it completely transforms their lives. And over the past 12 years, you know, we have lots and lots of people who've needed kidney transplants, and we have a lot of them who have gotten kidney transplants. But what really comes to mind with the opening of this program is the people who have not been able to get their transplants. So, being on dialysis, some people don't have reliable transportation, or they may not have family support. The things that are needed to get to a faraway transplant center. And if you are able to bring that transplant center closer to their home, not only does it invigorate them to get started in the process and to get a kidney, but it makes things so much easier for them, and takes away a lot of the socioeconomic barriers that are there for a lot of people who need a kidney and who are on dialysis. And we are going to fill up the box with referrals in the coming weeks, because there are so many people who are going to benefit from this program.
Thank you. And with that, we have a patient who's going to tell us a little bit about her story. Jen.Walsh.
Figuring out how to unmute, sorry. My name is Jennifer.Walsh, and I am just one of the many faces of chronic kidney disease, kidney failure, and now transplantation. Actually just celebrated my 11 years in September, so quite a milestone. Just really quick, I started with an autoimmune disease in my early 20s. Not really sure what brought it on, why it came, but it impacted my kidneys. Played a really long game of wait and see until you get to the point you're ready for transplant. And that happened to me in the summer of 2010. And I was approved for transplant, and I was fortunate enough, many people are not, to have a living donor lined up, who was actually my mother. And she was confirmed as a match in August 2010, and we were lucky enough to be scheduled for our transplant just in September of 2010. So once I was notified it was time to look at that process and what my options were, the process went relatively fast for me, and I am very grateful and lucky because of that, and many people are not. When we were going through the decision of, where do you get a transplant done? One of the main places was MUSC, and, at a minimum here in Greenville, that's a 3.5, 4-hour drive, depending on traffic. And so, listening to this program that is now get rolling here in Greenville, like everybody else has said, I know so many transplant patients and kidney disease patients here in Greenville that this is going to be a huge benefit too.
Thank you. So I'm going to go back to Dr. Merchant. There's a question in the chat.
Sure.
There you go.
Sorry,
So the question, I'm going to tell you what it is. No worries.
Okay.
The question is, have people have to use different out-of-state doctors for their transplant since it wasn't available here, or do doctors travel?
Could you repeat that one more time? I'm sorry.
Will have patients or people who are on the transplant list had to use different out-of-state doctors for their transplant to go there if it wasn't available here, or do doctors actually travel to people?
Sure. No, I think so. Both are correct, but only to a point. So number one, yes, people commonly have to travel. As we were just discussing, it's not unusual to go down to Charleston, to Augusta, Charlotte, or Atlanta in this region. Previous to having a program, patients would have to go to one of those most likely places to receive transplant care. That's very common. Now, some of those centers will also come up and see patients occasionally and even have more of a presence, but to get your actual transplant and the immediate postoperative care, for the most part, means you're traveling over 100 miles from this region. And so that's what's so valuable for the patients here, is that a lot of patients in the renal failure population, as Dr. Shusterman has referred to, and it's widely known, they just don't have resources always to make those long trips, especially at a moment's notice when an offer comes up or when they're ill. So they may not be able to go back to their primary center as easily when a problem comes up after surgery. The logistics of care become so onerous for patients that many of them give up or just can't even go through the process effectively to get on the list. And that's what we're trying to bridge the gap on, is those patients who have not had that opportunity, and to give them really the possibility of obtaining a transplant, whereas they otherwise didn't have it.
Right. The additional part of that question is having the local doctors be there to be able to walk you through the process and then be there in your own community. Talk to me a little bit about, the question's asking about how much of a benefit that is for a patient and their families.
Well, absolutely. It's just like I mentioned, the logistical pressures are relieved getting patients in and out and of their transplant program and center and the immediate need for care. It's the ability to come into your local hospital or office, in our case, to receive care, whether an emergency or just a follow-up. Those are big issues. Beyond that, it's a peace of mind of knowing that your physicians are close, and when you do have an emergency, you're not relying on people who are unfamiliar to pass on a message, which would commonly happen. In other words, if you have an emergency and you're not in the town where your transplant program is, you may have to go into the local ER and hope that they're going to be comfortable in caring for you. In many cases, they might be. In many cases, they may not be. And then it's trying to get from that hospital to your center through either an ambulance or personal transport. Again, still becomes a logistical difficulty. I think in so many ways, it also touches to what our goals are. Our goal is also to bring a transplant culture to this region and a presence in it's everything from education about transplant care and the fact that our program exists and we're here to help the patients of the region, but also about donation and other aspects of the whole transplant continuum that are important for this region. And hopefully we'll touch issues such as getting donation rates up and opportunities for patients to obtain kidney transplants in a more efficient fashion, and give those people, most importantly, who don't have the ability to travel, an option for a transplant.
Thank you. With that, I'm going to go to Jen. This question is for you. The question is, how does that make you feel about when you were doing your transplant, to have been able to do it closer to home? Because you were transplanted where and how far away how long did it take you to get there?
So yeah, I was located here in Greenville, and I traveled to MUSC. During the, you have your kind of pre-transplant process where you're going through your testing to determine whether or not you're eligible for transplant. Then you have your transplant, and then you have all of your post-care. And one of the things that stands out in my mind, and again, I was very, very thankful to have a family and just an amazing support system that helped me through that process. But like I said before, many people don't. And one of the things that I found, I guess it was eye-opening to me, was, after transplant, I had daily, and I say after, as in I've had the transplant, I'm in the hospital, I'm released from the hospital. I had daily testing and visits that I had to do. And I don't remember off the top of my head if it was a week or 2 weeks, but it was frequent. So I actually had to stay in the Charleston area at MUSC. And when we were first trying to figure out, where do I stay? Where does in this case, my donor, living donor mom stay? Where does our care team stay? And you start thinking about, a hotel. Well, how are you going to pay for a hotel? What are you going to do for meals in a hotel? And when you start to learn about the transplant process and kidney care, diet is such a huge, important factor. You have your prescriptions, you have your care team, but that diet can be one of the things that makes or breaks the success of that transplant. How are you supposed to do that when you're in a hotel room with a microwave? And those were one of the things, that was just one thing that was so surprising to me, thinking about how many other patients are out there and what they do in that situation. If we had had a local solution, right, you don't have to worry about those things. You have people who can stay at your home. Your caregivers are probably in the area. It's maybe a 15-minute ride to the hospital to get your pre-transplant testing done, to have your surgery, to have your aftercare. Those are just all things that you don't really think about until you're in the thick of it, and I didn't. And so there's a lot of added stress and burden there, aside from the financial aspects of it.
Yeah, thank you so much. I'm going to go to Dr. Shusterman, because I know that he was saying about his patients, and I'll just let him talk about how he feels like that proximity will be such an important part for them. You're muted. Yeah.
So, everything Jen said is so true about those added burdens of being far away from home when you're in the process of getting a transplant, and then when you get that transplant, imagine just being sick in general and being, 3.5 hours from home and trying to deal is really, really difficult. But having a transplant program in the area, I think, is really going to, it's going to allow everybody who lives here to feel like they are part of, a culture, as Dr. Merchant said, that supports transplant. And it'll allow them feel that, if I'm sending somebody to Charleston, it doesn't feel like I'm part of the program. As a local nephrologist, feels like I'm sending them somewhere else to get things done. And having a program here, I think, will give my patients more comfort that we're part of this program and part of this process, and allow them to feel more comfortable going through it and have trust that they'll get through it safely and quickly.
Thank you. With that, I'm going to go to Dr. Supper. Dr. Superdock, the question is, since there are more than 1,300 people waiting for transplant, how soon can these patients expect to receive the transplants, start receiving transplants at our program?
Well, we are up and running. We could do a transplant tomorrow if the right patient and donor were available. I think Jen alluded to this in her story, that her mother was able to give her a kidney. And I certainly hope, Jen, that your mother is doing well. But many people don't have a suitable living donor. I mean, many patients come from families that are just riddled with diabetes and high blood pressure and the same diseases that they've suffered from that have caused their kidneys to be weak in the first place. And in those situations, when you don't have a live donor, you have to rely upon a deceased donor. Deceased donors kidneys come from anyone who has signed their organ donor card and has chosen to share their life upon their declaration of death, to share their life to help others who are in need. There is a shortage of deceased donor organs out there. We at Greenville Memorial Hospital will be accepting donors from as far as 250 miles away, and in rare circumstances, even further away than that. And any organs that become available within this 250 nautical mile radius away from Greenville, our patients will be on the list to have an opportunity to receive those kidneys equal to all the other transplant centers in the region. So we are hopeful that perhaps our location may help people like Jen, who were previously listed at Charleston, by being on our list here in Greenville, would have access to kidneys much further west than she would have had access to just being on the list in Charleston. And then I think Dr. Merchant alluded to the fact that we're having a culture of transplant, that we're hopeful that as we perform more and more transplants at Greenville, or in Greenville, that we're going to hear more and more amazing stories of how somebody's gift has benefited somebody else. And more people will sign up to be organ donors. More people perhaps will even call our office and offer to donate a kidney to a stranger. And that this kind of culture of the awareness of the need and the awareness of just how amazing this gift is going to change our community and increase the availability of organs.
So there's a question about how do we encourage patients during the transplant process, and what do we tell them during the process if they're worried about the challenges that they might face?
Yeah, it's hard. People who have kidney failure, who don't have a living donor, will be evaluated, will get on the waiting list, and then they're going to have to wait until that organ becomes available. And that can be an incredibly trying time for people who are so anxious to be relieved of the burdens of dialysis. And we will be interfacing with them on a regular basis. We will have support groups. We will have a robust staff here with telephones ready to answer if patients just need to call and talk to somebody as they're waiting for that happy day when they get the organ. So, we will do our best to support people at all phases, from the moment they call to get an appointment, or the moment that Dr. Shusterman faxes a record to us, to when they get their kidney and then beyond their transplant, to ensure that kidney lasts in their body as long as possible.
Thank you. With that, we're going to go to final thoughts. I'm going to go to Dr. Merchant for his final thoughts. We don't have any additional questions.
Well, I appreciate it. I think I just summarize where we are right now is excited and humbled at this opportunity. And we do believe this is going to be an amazing new resource for the community here and beyond. And we are looking to, at a baseline, have outstanding outcomes for our patients, a caring, nurturing environment, and get patients listed as quickly as we possibly can and transplanted as quickly as we possibly can, and really focus on the things that we know are hardest for the patients, which is they're at their most vulnerable, and the communication that we give them, the hand-holding as they walk through the process are sometimes the things that mean the most. So personalized care in a patient-centric environment with outstanding outcomes is really what we're trying to provide to the community here and the patients of South Carolina. And again, it's an amazing thing to be a part of, and we're so grateful to the community for supporting us. And we look forward to transplanting very, very soon.
Dr. Shusterman.
Well, Jen, I hope this is okay. I just, you know, I didn't expect it, but I got a little emotional seeing you here on the call. Just everybody, Jen was my patient, you know, soon after I started as a nephrologist here in Greenville. And probably the first person who I cared for who got a kidney transplant since I was practicing in the real world. And just to see how it's transformed her life over the last 11 years and how well she's done. And it's really, really special. A kidney transplant is a really special thing for somebody to give to somebody else and also to receive. It's really transformative, actually, for both people's lives. And I think this is just a great opportunity, and I'm honored to be part of the process.
Thank you. With that, we're going to go to Jen for her final thoughts.
Yeah, so Dr. Shusterman, I'm actually really happy you brought that up, because the next, you know, as part of my just closing thoughts here, we're talking a lot about, you know, community and support and what that means for patients. And, you know, everybody's different, right? But when we think about having a transplant, you obviously think, okay, your care is super important. Your surgery itself is important. Your prescriptions after are important. But something that we don't talk enough about is the hope that comes behind it, and the support that you're getting from your care team. And I think about, in this case, and I had just moved to Greenville 12 years ago and started with Carolina Nephrology, started seeing Dr. Shusterman, and ultimately ended up at MUSC. I think about how scared I was. You know, I wasn't even 25 years old at the time, and there really wasn't anybody else, or very few people in my age group that were willing to talk about, you know, their experience. And that is being sick in itself, but going through a process like that can be extremely isolating. And the care from my doctor and the transplant coordinator is what kept me going. And that relationship that we developed along the way is what got me to want to do the transplant, that got me to want to be precise with my medications and take care of myself and my diet. That was like that extra step, that push that I needed, that extra hope. And so I do think that, you know, when we think about all this and care teams and support groups, that feeling like you're part of something, and there are people there to fall back on, that can be life or death for people. And we think about having that locally is just going to make it that much more accessible to those that are in that situation. And in my case, you know, just because you've had one transplant doesn't mean you're not going to have another at some point. So, you know, in this case, I've had my kidney for 11 years. It's kept me here 11 more years. So I'm super thankful for that. But who knows what will happen tomorrow or in 6 months or 10 years. Might end up over at Prisma. So I just wanted to add that piece of it, because that really was the biggest piece for me, right? We talk about, knowledge being power, but that actually applying it, that applied knowledge that you're given is really what is going to make you successful. And you don't get that without your care team sharing that knowledge with you. Really, I would not be here today, not only without having the transplant, right, but without the care team that I had. And I'm still very much a part of that care team. So I just wanted to kind of highlight and speak to a little bit more about what Dr. Shusterman, Dr. Merchant, and Dr. Superdock have all spoken to. And one final note, and I don't feel like I can get off this call without saying it, but for anybody who does end up listening or watching this, we talk about the living donation aspect of it, right? And some people are lucky to have that, but not everybody has that. And next time around as a patient, you might not have that. So I'd like to just point out here too, it's super easy to register to be a donor. And you just go to donatelife.net. That's www.donatelife.net, or even registerme.org. And it is very, very easy to sign up and to save a life.
Well, those are some great final thoughts. I'd like to add my own final thoughts. My dad too was a kidney recipient before his death, and he lived 9 whole years because somebody gave him the gift of life. So I agree with you, Jen, that what a special thing. And we're all proud at Prisma Health to be a part of it. And we're looking forward to helping more families. So with that, those are our final thoughts. And we appreciate all of our reporters for listening. If you need any additional help, Sandy D's in the Upstate and me, we are your tech team partners, and we'll be happy to help. Thank you, and everybody have a great day.